This is about patience. This is not about money. This is not about something else. This is about patience. And sadly, the costs are going up for those folks in the individual and small group market. The access is going down, and it's only getting worse. You know the stories. Premiums increased 25% over the last year on average. Arizona had an increase of 116%. Deductibles are going up for many, many folks. If you're a mom or a dad out there and you make $40,000, $50,000, $60,000, your deductible in this market, in that individual and small group market, oftentimes is $8,000, $10,000, $12,000 a year. What that means is that you've got an insurance card, but you don't get care because you can't afford the deductible. And we know that this is happening by talking to the folks who are out there trying to provide the care. What's happening right now is that the American people are having to sacrifice in order to purchase coverage. And as I mentioned, many individuals can't afford the kind of coverage that they have right now. So they've got that insurance card, but they don't have care. What our desire is to drive down the health care costs for everybody. And the way that you do that is to increase choices for folks, increase competition, return the regulation of health care where it ought to be, which is at the state level, not at the federal level. All of these things that taken in their aggregate will in fact decrease the cost of health care and health coverage, and that will allow folks to be able to purchase the coverage that they want. This is a work in progress, and we'll work with the House and the Senate in this process. As you know, it's a legislative process that occurs. I'm glad you pointed out the bills on the table there. As you'll see, this bill right here was the bill that was introduced in 2009 and 10 by the previous administration. Notice how thick that is. Some of you will recall that I actually turned the pages and went through that piece of legislation in a YouTube. The bill on the pile on the right is the current bill, and what it means is that we are making certain that the process, that the decisions that are going to be made are not going to be made by the federal government. They're going to be made by patients and families and doctors.